Podcast 27, Week 29. Welcome to the podcast, Your Pregnancy Week by Week. This podcast covers the 40 weeks of pregnancy in 38 segments and is based on the book Your Pregnancy Week by Week by Dr. Glade Curtis, MD, and me, Judith Schuler, MS. The information in our books and podcasts is a general informative guide about pregnancy. None of the information we provide is intended to replace, countermand, or conflict with the advice given to you by your own doctor. Always follow his or her advice. Use the information you learn here as a starting place in your dialogue to help you put your pregnancy concerns, questions, or interests into words. The goal of every pregnancy is a healthy mom and a healthy baby. To that end, our podcasts cover many topics. In each weekly podcast, we'll highlight information contained in the same weekly discussion in our book. We suggest you read each weekly chapter to learn further information, such as how baby is growing and changing and how you're growing and changing too. Our book also contains illustrations of changes in baby or you, advice for dads, charts, lists, boxes, an exercise for every week, a comprehensive glossary, hints, tips, snippets, and blurbs we just can't reproduce in a podcast. So let's get started on this week's discussion. We're going to look at week 29. Infants born prematurely may be tiny. Even a few weeks less time in the uterus can have a dramatic effect on baby's size. There are some difficult questions to answer when premature labor begins. Is it better for the baby to be inside the uterus or to be delivered? Are the dates of the pregnancy correct? Is this really labor? It's usually best for baby to stay inside your uterus for as long as possible, but sometimes it's better for baby to be delivered early. In nearly 25% of all preterm births, baby is delivered early for its health and safety. In most cases, we don't know what causes premature labor, but we always try to determine a cause so treatment may be more effective. Half of the women who go into preterm labor have no known risk factors. Some experts believe up to half of all premature births may be tied to infections. Iron deficiency has also been linked to increased risk. Some researchers believe taking your prenatal vitamin every day may help cut your risk by as much as 50%. So keep taking those prenatal vitamins. A test called SalEst may help determine if a woman could go into labor early. The test measures levels of estriol in a woman's saliva. Research has shown there is often a surge in this chemical several weeks before early labor. A positive result means a woman has a 7 times greater chance of delivering her baby before the 37th week of pregnancy. The treatment used most often for premature labor is bed rest. About 20% of all pregnant women are prescribed bed rest. It can be successful in stopping contractions and premature labor. It may also be advised for other pregnancy conditions such as preeclampsia or high blood pressure. The term bed rest can cover anything from cutting back on activities to being confined to bed for 24 hours a day, getting up only to go to the bathroom or to shower. Not all experts agree bed rest is the best treatment. It's okay to discuss bed rest and all of its implications with your doctor if he or she recommends it. Ask about getting a second opinion from a perinatologist who deals with high-risk pregnancies if you have concerns. Some negative aspects of bed rest include an increased risk of a blood clot in your leg, gaining too much or too little weight, and muscle weakness or loss of bone calcium. After bed rest, take it easy getting back into the swing of things. It can take some time to return to normal. It can be pretty boring being stuck in bed, but there are some things you can do to keep yourself occupied. No matter what you do, take good care of yourself and follow your doctor's advice. Bed rest may not work to stop premature labor. When it doesn't, your doctor may try various medications to suppress labor. You may need to see your doctor frequently. He or she will probably monitor you with ultrasound and other tests. We hope you've been listening to your body during pregnancy. When you feel hungry or thirsty, you're eating or drinking something within reason. Eating smaller, more frequent meals provides a constant supply of nutrients to your growing baby and may help you feel better. It's important for you to take good care of your teeth during pregnancy. Brush and floss regularly. Pay attention to gum care. If brushing your teeth makes you nauseous, try a different toothpaste or plain baking soda. Avoid mouthwashes that contain alcohol. See your dentist at least once during pregnancy and be sure to tell him or her you're pregnant. During pregnancy, hormones and increased blood volume can make gum problems worse. Gingivitis is the first stage of periodontal disease. If you have it, you have red, swollen, bleeding gums. It's caused by bacteria growing in the spaces between gums and teeth. Bacteria can enter your bloodstream, travel to other parts of the body, and cause infections in you, which in turn could harm your baby. Regular flossing and brushing can help prevent this. If you need dental work, postpone it until after the first 13 weeks of pregnancy when possible. However, you may not be able to wait if you have an emergency. In some cases, antibiotics or pain meds may be necessary. If you need medication, talk to your pregnancy doctor before you take anything. Many antibiotics and pain meds are okay to take during pregnancy, but some should be avoided. Be careful about anesthesia for dental work. Local anesthesia is okay, but avoid gas and general anesthesia when possible. If you have a serious dental problem, don't ignore it. If you don't treat it, you could have serious problems. Dental x-rays are sometimes necessary and can be done during pregnancy if your abdomen is shielded with a lead apron before x-rays are taken. Is your partner excited about going to prenatal appointments? Some men are, others not so much. It's always a good idea to take your partner with you to as many prenatal appointments as possible, if he wants to go. Or maybe your mother or mother-in-law would like to go with you to hear baby's heartbeat. It's a good idea to wait until you've already heard baby's heartbeat before bringing other people. You don't always hear it the first time, which can be disappointing. Always check with your doctor and staff before you bring any children with you to an appointment. Some women bring their children, but if you have problems or have a lot to discuss, don't bring anyone with you except your partner, and leave sick children at home. Don't expose everyone else in the waiting room. Has your doctor talked with you about breath training? If you practice different breathing exercises now, it could benefit you during labor and delivery. You will probably learn about different breathing techniques in childbirth classes. You can also ask your doctor for breathing techniques you can start practicing now. Remember, our podcasts give you the highlights of what may be happening in any given week. Check our book, Your Pregnancy Week by Week, for more detailed information. You may also want to check out our book for partners, Your Pregnancy for the Father-to-Be. It covers pregnancy from a man's point of view and provides lots of valuable information a man may find very useful. If you want to find out more about our podcast, visit our website, yourpregnancyweekbyweek.com. If you're looking for something specific, check out the podcast topics list. It details topics covered in each podcast, so you can listen to a particular podcast or read a certain chapter week if you want more information, or if you want to check out something you missed or a topic we haven't covered yet.